4 at a time, and some people end up on 5. Why not just jump straight to the drugs? Well, they don't treat the underlying cause, and they can cause side effects. Less than half of patients stick with even the first-line drugs, perhaps due to the adverse effects such as erectile dysfunction, fatigue, and muscle cramps. So, what are these recommended lifestyle changes? They recommend to control one's weight, salt, and alcohol intake, engage in regular exercise, and adopt a DASH eating plan. The DASH diet has been described as a lacto-vegetarian diet, but it's not. It emphasizes fruits and vegetables and low-fat dairy, but just a reduction in meat. Why not vegetarian? We've known for decades that food of animal origin is highly significantly associated with blood pressure. In fact, if you take vegetarians and you give them meat, you can watch their blood pressures go right up. I've talked about how there are benefits to getting blood pressure down as low as 110/70, but who can get that low? Populations eating plant-based diets, like in rural China, about 110/70 their whole lives, with meat only eaten on special occasions. Or rural Africa, where the elderly have perfect blood pressure, as opposed to hypertension. In the Western world, as the American Heart Association has pointed out, the only folks really getting down that low were the strict vegetarians, coming out at about 110/65. So when they created the DASH diet, were they just not aware of this landmark research done by Harvard's Frank Sachs? No, they were aware. The chair of the design committee that came up with the DASH diet was Dr. Sachs. In fact, the DASH diet was explicitly designed with the #1 goal of capturing the blood pressure-lowering benefits of a vegetarian diet, yet contain enough animal products to make it palatable to the general public. In fact, Sachs found that the more dairy the lacto-vegetarians ate, the higher their blood pressures. But they had to make the diet acceptable. Research has since shown that it's the added plant foods, not the changes in oil, sweets, or dairy, that appears to be the critical component, so why not eat plant-based? Recent meta-analysis showed vegetarian diets were good, but strictly plant-based diets may be better. Vegetarian diets in general confer protection against cardiovascular disease, some cancers, and death, but completely plant-based diets seem to offer additional protection for obesity, hypertension, type 2 diabetes, and heart disease mortality. Based on a study of 89,000 people, those eating meat-free diets appeared to cut their risk of high blood pressure 55%, but those eating meat-free, egg-free, and dairy-free had 75% lower risk. If, however, you're already eating a whole food plant-based diet, no processed foods, no table salt, and you're still not hitting 110/70, there are a few foods recently found to offer additional protection. Ground flax seeds, a few tablespoons